My informative speech. My informative speech is about diabetes. Diabetes have claimed the lives of many family members. And I think a great deal is mainly due to lack of knowledge, understanding about the disease. To give a brief history of family members that I have lost to diabetes is my mom, 2 aunts, and I have 2 brothers that have their legs amputated. I also have a friend that has a severe case of diabetes. Getting plenty of exercise and eating a healthy diet will reduce the risk of diabetes. It will also play an important part in helping reduce cholesterol levels so that you will be able to breathe without complications of feeling tightness in your chest or other areas. There are 3 types of diabetes that everyone should be aware of. How it affects the body and get rid of stored glucose. Type 1 diabetes is caused when the pancreas can no longer make the insulin necessary to transport sugar from the blood into other cells of the body for energy. According to Deborah Manzella, RN, for former About.com guide. It is also said, according to Deborah, that someone who has type 1 diabetes must take insulin every day. My mother was diagnosed with type 1 diabetes early in age, but seemed to never have gotten in control. She suffered many of the symptoms, such as hyperglycemia, because there was no insulin being produced in her blood, which caused her blood sugar to rise. Such symptoms as increased urination, increased thirst, fatigue, weight loss, and blurred vision kept my mother down and wasn't able to perform her daily task. Type 2 diabetes often does not have any noticeable symptoms, and you may not know you have it. Regular checkups with your physician and some basic blood tests will help you find out early in the disease if you have it. This disease is not to be taken lightly. Therefore, early detection will reduce the chances of this chronic disease. This disease, I think, is hereditary because of the history of it in my family. With regular exercise, eating the right foods, maintaining a normal weight will allow you to feel better, as well as reducing the chances of this deadly disease. It is important to remember that it is possible to control your diabetes instead of it controlling you, says Manzella. Gestational diabetes occurs only in pregnant women. Poorly controlled diabetes in pregnant women can hurt the baby because your pancreas works overtime to produce insulin, but the insulin does not lower your glucose level. Gestational diabetes starts when your body is not able to make and use all the insulin it needs for pregnancy. Without enough insulin, glucose cannot leave the blood and be changed to energy.